Welcome back to Andersen Acres. Today we're diving into a topic that's a little heavier, but also incredibly important for anyone who raises rabbits. I want to talk about a parasite that can kill. Now, this one doesn't have a parasite, but it's not uncommon. I'm talking about E. cuniculi. Okay, I can't pronounce what the E stands for, so I'm just going to put it at the top of the screen here. That's what it stands for, and it's a deadly parasite. If you've ever seen a rabbit with wryneck, or you've had one suddenly go downhill neurologically with no clear cause, this microscopic menace might be the culprit. It's sneaky, it's serious, and worst of all, it's hard to detect until it's already done major damage. So whether you keep rabbits for meat, show, fiber, or just companionship, you'll want to stick around. We're going to talk symptoms, transmission, risk factors, diagnosis, and what you can do even if there's no current cure, because we don't have one right now. So let's get into it. So first off, what is E. cuniculi? It's a tiny parasite that infects rabbits. It can infect other animals too, including guinea pigs and even humans in very rare immunocompromised cases. But mostly it's rabbits. And in rabbits, it's mostly known for causing neurological issues. It can damage the brain, the spinal cord, the kidneys, the heart, and even the eyes. That's why it's such a big deal. It doesn't just attack one system, it goes for several all at once. You might see several different signs, and they could happen all at once. You'll see wryneck, which is that classic head tilt. You know, the rabbits normally are like this. Rabbits shouldn't be like this. Their heads should be fairly straight. You might see tremors or uncontrolled rolling. You might see a loss of coordination, partial paralysis, kisses. Kisses from Ent. This is Ent, by the way. You also might see partial paralysis or seizures, perhaps urinary incontinence, and cataracts or even full-on blindness. Okay? But here's the problem. These symptoms could also be caused by other issues, right? They're not necessarily E. cuniculi. Okay, it could be Pasteurella infections or trauma or tumors, you never know. So E. cuniculi is often misdiagnosed or missed entirely, at least until it's too late. How do they get it? Okay, E. cuniculi is most commonly transmitted through urine. The parasite is shed when an infected rabbit urinates, and other rabbits will pick it up through contact, especially if they share bedding, food bowls, or living spaces. Hi. This means it's highly contagious in colony or group housing situations, and even places where you thought everything was clean. It can also be transmitted from mother to kit, so mama to baby, either during pregnancy or right after birth. A doe might look perfectly healthy and still pass the parasite on to her little ones. We're going to try not to muffle the mic end. We're just going to try. Okay, we're just going to give it a shot. So the little ones can get it even if you didn't know mama had it, okay? And sometimes mama will have it, you'll have had no warning, and all of a sudden the babies will start dying because the babies are suffering from it, even though mama is not herself necessarily affected by it. It happens. So how common is E. cuniculi? Very, okay? Some studies show as many as 40% of rabbits testing positive for antibodies, meaning they have been exposed to it at some point. Many of these rabbits will never show symptoms, okay? But that doesn't mean they're not carriers. Even if you've been breeding or raising rabbits for a while, there's a good chance you've had at least one rabbit at some point that has had E. cuniculi, okay? And if they've been in close proximity with your other rabbits for an extended period of time, there's a chance they passed it on, okay? Even if you didn't know that you had that at the time. And once it gets in, it's a devil to eliminate. So let's talk about diagnosing, because you can't eliminate what you can't find. Here's where things get really frustrating. E. cuniculi is nearly impossible to diagnose without a necropsy. If you don't know what a necropsy is, it's basically an autopsy, but for animals, which means they have to be dead for you to find it. And that means most people don't find out their rabbit had it until after the rabbit has died and a full exam is actually performed. There are blood tests where you can tell if your rabbit's been exposed, but they don't really confirm whether the rabbit is actively infected, okay, or it's just carrying the antibodies from past exposure. There's no real great way to tell if your rabbit's currently infected. We don't have a test for that yet. Not a great one anyway. So when symptoms show up, many owners kind of have to guess and treat based on likelihood, not certainty. That's annoying, but what can you do? Now, is there a cure? No. If there was a cure, rabbit owners would be jumping for joy. There is no known cure for E. cuniculi. Once it causes neurological damage, any damage really, but specifically neurological damage, there's no way to reverse it. That's why early detection and prevention is so crucial. Now, some rabbit owners and vets have had some success using fenbendazole, also known as Panicure. It's hit or miss whether it works. It does sometimes help slow the progression or reduce symptoms, especially if given early, but it's not a guaranteed fix. Anti-inflammatories and supportive care like fluids and hand feeding can help the rabbit stay more comfortable, but they're not going to eliminate the parasite. So once you have it, you kind of just have to roll and hope, right? So can it be prevented? Sorta, but not really. Here's some things you can do. Keep living areas clean and dry. Since the parasite spreads through urine, cleanliness is crucial. If you use cages or you use hutches, get them cleaned out. You don't want them walking in their own pee and poop. Okay, that spreads parasites. You want to quarantine new rabbits for several weeks, so 30 feet for 30 days. How often do I say it? 30 feet for 30 days for new rabbits. Okay, before introducing them to your herd, so you don't introduce a parasite that you can't deal with. Also, avoid overcrowding and minimize stress. A stressed rabbit is more vulnerable. And you want to test your breeding stock if that's at all possible. Even if you can't prevent infection, you can reduce the spread by knowing who your carriers are. If Ent isn't a carrier, she can't spread it to her children. So if your vet offers testing, get your potential does tested, because if they don't have it, they can't pass it to the babies. So get your does and your bucks tested if you have the ability to do so. Not all vets offer it. Not all vets have that test, but you can try. You can ask. Also, you want to practice good biosecurity. You want to wash your hands, sanitize cages and tools, and don't move bedding or hay between pens. Okay? Clean the pen, get rid of the bedding. Don't move it to a different pen. That's not good. If a rabbit is showing symptoms and you suspect E. cuniculi, isolate them right away. Okay? Now, real talk. I'll be honest with you. We've had to deal with this ourselves a few years ago. To my knowledge, nobody has E. cuniculi on our farm right now, but we've had it. We had rabbits showing signs of wryneck, and we tried everything. Antibiotics, anti-inflammatory, supportive feeding. I tried everything. She improved a little bit, never fully recovered. And we'll never know for sure if it was E. cuniculi or not, because a lot of times you don't. And that's the hardest part of this. You can be doing everything right and still face this kind of heartbreak. But knowing what you're up against helps you make better decisions for your animals and helps you spot problems early before it spreads. So while you might not be able to save the sick one, maybe you can save the others. And that is worth something. So should you cull? This is a question every time I talk about E. cuniculi, somebody asks, should I cull the infected rabbits? Judgment call. It's a tough topic, and it does come up, especially for breeders or meat rabbit keepers. Do you cull those who are positive for E. cuniculi? If you have a confirmed E. cuniculi case or you have a strong suspicion, you might have to make a hard decision. Okay, generally, I cull only if the rabbit is obviously hurting or uncomfortable, because that's not fair to the rabbit. But everyone has to make their own choice here. Some people choose to cull affected rabbits to protect the rest of the herd. Others manage it with isolation and controlling symptoms. So you have to choose what method works best for you. Okay? There's no right or wrong answer here. It depends on your goals, your philosophy, and your particular situation. Just be honest with yourself about what's best for all your animals, not just the one. Okay? The all matters too. Now, E. cuniculi is a scary parasite, not because it's rare, but because it's so common and so hard to detect. It's another reminder that even tiny creatures can do massive damage. But armed with knowledge, we can protect our herds better, act faster, and maybe even prevent the next case. At least we can try. At least we'll know that we did try. That's about it for us here today at Andersen Acres. Drop a comment below if you've ever dealt with E. cuniculi or have tips for managing your rabbit's health. We'll see you tomorrow.